Today we have with us Dr. Pramila Kalra. Madam is a professor and consultant endocrinologist, Ramaiah Medical College and Hospital, Bangalore. Madam's topic is being critical insights from Pan India, Clinical Trial Network and Diabetology Registry. Ma'am, can you kindly sum up few words for our media audience?
Yeah, so this was a diabetology registry which we did over a period of 5 years. This registry was funded by BIRAC, and this we did at 7 centers pan India. So we tried to include all the centers which are representative of North, South, West, and East, and we registered around 25,077 type 2 diabetes mellitus patients, and we tried to see what is their glycemic control, how they are managed, and how the complications are being screened, and what is the prevalence of the complications. So what we found that most of these patients had a poor glycemic control in spite of the facilities being available, and we found that around 80% or more had HbA1cs beyond 7. Another interesting thing we found was that in spite of the BMI being normal, that is less than 23 kg per meter square as per our cutoffs, we still found that majority of them had abdominal obesity, especially women. So though they were seemingly normal as per BMI, but they had abdominal obesity. So that was another thing which we found, which was an interesting finding. Also, we found that in the medication use, most of the patients were using metformin, and they were still using a lot of sulfonylureas all over India, whether it is a government center or a private setup or a rural or a urban. And also, we came to know that the complication monitoring was not very good at many of the places. And these patients who had come first time to these centers were counseled about complications. And what we found that in the follow-up, many of these patients had better complication screening for retinopathy, nephropathy, and neuropathy. And we did see that the number of the patients having complications increased on follow-up, not for the reason that they got more complications, but more of them or most of them was screened for the complications. And we also saw that the physical activity was very, very poor in these patients. They were mostly doing some sort of physical activity, which was just for 5 to 10 minutes in a day, and they were not doing much. So the physical activity was not good in most of these centers, whether it is south, north, east, or west. And also, we found one more thing, that the addiction rates were quite high. For smoking and alcohol, we found that Karnataka was quite on the top. And for tobacco chewing, we found Meghalaya was quite on the top. So that was another thing which we found, which was an interesting finding from this registry. So this registry has given us an insight that how best we should manage our diabetes patients, how we can improve the glycemic control. And this registry has also helped us to create a ready-made data set of patients who can be called or asked if they are ready to take part in the future clinical trials, especially for Indian drugs or Indian pharmaceutical companies, if they want to do clinical trials. And if these patients are ready, they can take part on those clinical trials as well. Thank you.
Thank you so much, ma'am, for your valuable time and insights.
Thank
It was
you.
pleasure having you, ma'am.
Me
Thank you.
too. Me
Thank
too.
you.
Thank you.
Thank you.